The sensory system, vision, the retina. The retina is composed of several layers and contains specialized cells for the initial processing of visual stimuli. The photoreceptors, rods and cones, change their membrane potential when stimulated by light energy. The change in membrane potential alters the amount of neurotransmitter that the photoreceptor cells release onto bipolar cells in the outer synaptic layer. It is the bipolar cell in the retina that connects a photoreceptor to a retinal ganglia cell, or RGC, in the inner synaptic layer. Their endocrine cells additionally contribute to retinal processing before an action potential is produced by the RGC. The axons of RGCs, which lie at the innermost layer of the retina, collect at the optic disc and leave the eye at the optic nerve. Because these axons pass through the retina, there are no photoreceptors at the very back of the eye, where the optic nerve begins. This creates a blind spot in the retina and a corresponding blind spot in our visual field. Photoreceptors in the retina, rods and cones, are located behind the axons, RGCs, bipolar cells, and retinal blood vessels. A significant amount of light is absorbed by these structures before the light reaches the photoreceptor cells. At the exact center of the retina is a small area known as the fovea. At the fovea, the retina lacks the supporting cells and blood vessels and only contains photoreceptors. Therefore, visual acuity is the greatest at the fovea. This is because the fovea is where the least amount of incoming light is absorbed by other retinal structures. As one moves in either direction from this central point of the retina, visual acuity drops significantly. The difference in visual acuity between the fovea and peripheral retina is easily evidenced by looking directly at a word in the middle of this paragraph. The visual stimulus in the middle of the field of view falls on the fovea and is the sharpest focus. Without moving your eyes off that word, notice that words at the beginning or end of the paragraph are not in focus. The images in your peripheral vision are focused by the peripheral retina and have vague, blurry edges and words that are not clearly identified. As a result, a large part of the neural function of the eye is concerned with moving the eyes and head so that important visual stimuli are centered on the fovea. There are 3 types of cone opsins that are sensitive to different wavelengths of light and provide us with color vision. By comparing the activity of the 3 different cones, the brain can extract color information from visual stimuli. For example, a bright blue light that has a wavelength of approximately 450 nanometers would activate the red cones minimally, the green cones marginally, and the blue cones predominantly. The relative activation of the 3 different cones is calculated by the brain, which perceives the color as blue. However, cones cannot react to low-intensity light, and rods do not sense the color of light. Therefore, our low-light vision is, in essence, in grayscale. In other words, in a dark room, everything appears a shade of gray. If you think that you can see colors in the dark, it is most likely because your brain knows what color something is and is relying on that memory. Anosmia, a blunt force trauma to the face This is such as that common in many car accidents, can lead to the loss of the olfactory nerve and subsequently loss of the sense of smell. This condition is known as anosmia. When the frontal lobe of the brain moves relative to the ethmoid bone, the olfactory tract axons may be sheared apart. Professional fighters often experience anosmia because of repeated trauma to the face and head. In addition, certain pharmaceuticals, such as antibiotics, can cause anosmia by killing all the olfactory neurons at once. If no axons are in place within the olfactory nerve, then the axons form newly formed olfactory neurons, have no guide to lead them to their connections within the olfactory bulb. There are temporary causes of anosmia as well, such as those caused by inflammatory responses related to respiratory infections or allergies. Loss of the sense of smell can result in food tasting bland. A person with an impaired sense of smell may require additional spice and seasoning levels for food to be tasted. Anosmia may also be related to some presentations of mild depression, because the loss of enjoyment of food may lead to a general sense of despair. The ability of olfactory neurons to replace themselves decreases with age, leading to age-related anosmia. This explains why some elderly people salt their food more than younger people do. However, this increased sodium intake can increase blood volume and blood pressure, increasing the risk of cardiovascular diseases in the elderly. Ear, nose, and throat diseases and disorders. Otitis media. Otitis media is known as inflammation of the middle ear canal that involves the eardrum. It is commonly seen in younger children due to bacterial and viral infections. Symptoms include possible fever, cough, and cold symptoms, hearing loss, irritability, and otalgia. Treatment involves symptomatic control as well as antibiotic, such as amoxicillin, use if necessary. Otitis externa. Otitis externa is inflammation of the external ear canal and is known as swimmer's ear because it is associated with its exposure to water. Its clinical presentation and management are the same as otitis media. Conductive hearing loss. Hearing loss occurs when something disrupts sound through the mid and outer ear, such as physical damage to the eardrum, perforation. Hearing loss can be managed with pharmacotherapy, surgery, or a combination of the two. Sensorineural hearing loss. This hearing loss results from damage to the neural structures. Tumors, as well as exposure to loud noises, acute and chronic, can lead to this type of hearing loss. Tinnitus. Tinnitus is a condition of ringing in the ears. It is due to inflammation of the middle ear. It is the first indicator of nerve damage, particularly in sensorineural hearing loss. Otosclerosis. This is hardening of the ear due to new bone formation of the inner ear ossicle. Its etiology is of idiopathic or hereditary origin. That means the cause for the disease is unknown or through family genetics. Clinical features are consistent with that of conductive hearing loss. Further management is required by an ENT surgeon. Rhinitis. Rhinitis is inflammation of the nasal cavity mucosal lining, which can lead to congestion and rhinorrhea, or runny nose. The causes are due to allergic reactions as well as viruses. Treatment regimens include symptomatic management, saline sprays, and oral antihistamines. Daiquiri Stenosis, also known as nasolacriminal obstruction, is an obstruction of the nasal lacriminal duct. It prevents tears from draining from the eyes into the ducts of individuals that have excessive tearing. The etiology is congenital and is the result of the duct not forming properly. This condition is managed via observation as it resolves over time, usually after 1 year.